During the last weeks of pregnancy, the baby continues to gain weight and accumulate more body fat. As the baby grows larger, the uterus expands, and the mother may experience increased discomfort, especially in the lower back, pelvis, and abdomen. In preparation for birth, the baby may change positions, such as shifting from side to side or rotating within the womb. Most babies eventually settle into a head-down position in the mother's pelvis, with their head closer to the birth canal. It may also increase pressure on the bladder, leading to more frequent urination. This position, known as cephalic presentation, is considered ideal for vaginal delivery. In anticipation of labor and impending parenthood, the mother may experience a wide range of emotions. She may feel excited, anxious, nervous, or a combination of these emotions. As labor approaches, true labor contractions begin. These contractions follow a regular pattern and become increasingly frequent, longer, and more intense over time. They lead to the gradual dilation of the cervix. The amniotic sac may rupture, commonly known as the water breaking, at different times during labor. It may rupture on its own without any intervention. If the amniotic sac has not ruptured naturally, the healthcare provider may intentionally rupture it using a sterile instrument called an amniotomy hook. The hormone relaxin helps soften and loosen the ligaments and tissues in the pelvic area. This allows the vaginal walls and the perineum, the area between the vagina and the anus, to become more flexible and stretchable. The cervix then begins to change in preparation for delivery. It gradually softens, thins out, effaces, and dilates. The cervix opens gradually to allow the baby to pass through. Dilation is typically measured in centimeters, with 10 centimeters indicating full dilation and readiness for pushing. Once the cervix is fully dilated, the mother enters the pushing stage. She actively pushes during contractions to help move the baby down the birth canal. As the baby's head moves through the birth canal, the vaginal walls stretch to accommodate its size. The vaginal tissues are naturally elastic, allowing for significant stretching without causing permanent damage. Sometimes, a healthcare provider may perform an episiotomy to facilitate the baby's birth and help prevent severe tearing. This is a surgical incision made in the perineum to enlarge the vaginal opening. During the pushing stage, the baby's head emerges first, followed by the rest of the body. The baby's shoulders rotate to align with the pelvic outlet, allowing a smooth passage through the birth canal. After birth, the baby's respiratory system undergoes significant changes as the baby transitions from receiving oxygen through the placenta to breathing air independently. The umbilical cord is then clamped and cut, separating the baby from the placenta. This is usually done after the cord has stopped pulsating to ensure the baby receives the maximum possible amount of blood from the placenta. The mother continues to have contractions to deliver the placenta. This stage is typically shorter and less intense than the previous stages of labor. Finally, the healthcare provider evaluates the baby's condition, including vital signs and overall well-being. It is important to provide skin-to-skin connection as soon as possible, ideally within the first few minutes after delivery. Immediately after delivery, the uterus begins a process called involution. Hormonal signals, particularly the release of oxytocin, help the uterus to contract, reducing its size. The process helps expel any remaining placental tissue and promotes healing of the uterine lining. Vaginal discharge, called lochia, consists of blood, mucus, and uterine tissue shed as the uterus heals. This discharge typically lasts for several weeks and gradually changes in color and consistency. As the body heals, the breasts may become engorged as milk production increases, causing them to feel swollen, tender, and firm. This bonding experience can release hormones like oxytocin and endorphins, contributing to relaxation, happiness, and reduced stress. Oxytocin also promotes uterine contractions, helping the uterus to return to its pre-pregnancy size. Caring for a newborn is a shared responsibility that both parents should be involved in. Sharing responsibilities can alleviate the physical and emotional strain on the mother.